Isinusulong ng health officials ang teleconsultation kung banayad lang ang sintomas ng COVID-19. Yan ay para maibsan ang pagsisiksikan sa mga ospital. Pag-uusapan natin yan sa serbisyo ngayon. Kasama si Anna Bigornia, country head ng kumpanyang MedCheck. Isa po ang MedCheck sa mga accredited telemedicine services providers ng Health Department. At pwede rin po kayong sumali sa ating talakayan. I-post ang inyong mga tanong o komento sa ating Facebook Live. Magandang hapon, Ms. Bigornia.
Good afternoon, Ruth.
Okay, una muna, bakit ba mahalaga na magkaroon ng teleconsultation ngayong mataas or, well, sa ibang, dito sa Manila, pababa na, no? Pero sa ibang lugar kasi mataas pa rin ang bilang ng COVID-19 cases?
Yes, so actually during the pandemic, even now, kahit mataas yung cases, very limited ang movement ng doctors tsaka patients. So telemedicine provides an opportunity para doctors and patients may continued patient care. So constantly you can have the conversation with your doctor kahit wala kayo sa ospital. You can still get an e-prescription. You can still talk to your doctor about your symptoms and your doctor can give you treatment as well. Yung telemedicine din is important para ito ay parang new method of screening for patients. So bago kayo pumunta ng ospital, medyo at least high risk now, hindi na masyado ngayon, but nung high risk pa, nung high risk, hindi kayo ma-expose at ma-treat kayo ng doctor. So that's one of the important things that telemedicine was able to provide and help us with the doctor and patient relationship.
So kayo sa MedCheck ay isa kayo sa accredited ng DOH, no, para dito. Ano ba ang ginagawa ng MedCheck at saka ano ang mga services na ino-offer nyo?
Yung MedCheck po, we are an electronic health records platform. We do provide a platform for digital records for our patients, and the patients then can book appointments with their doctors. So the good thing po, if you go to medcheck.com.ph, you can look for a doctor, you can check any specialty and location. We have po doctors from Luzon, Visayas, Mindanao. Different specialties po yun. You can book an appointment, then have your telemedicine consultation.
So ang ino-offer nyo ay doctor's consultation only. Tapos syempre magre-reseta sila kung kailangan. Wala itong hindi pwede magpa-schedule halimbawa ng mga lab test or pupuntahan sa bahay. Walang ganon.
Wala po. So yung doctors pwede, kahit e-prescription, pwede din sila magreseta ng kung anong tests kailangan i-take ng patient. So once they do that, then the patient can decide where the most convenient location is for the patient to test, get the test, have a follow-up appointment with the doctor, and then get a proper diagnosis.
Paano ba ito nagwo-work? So, do you download? Do you go out to a website? May app ba ito? And then, yung minention mo na iba-ibang klase. Ako kasi na-experience ko magpa-teleconsult. Di ba may parang iba-iba kung anong kailangan mo. If it's for diabetes, if mismong for COVID-19, may mga ganon, ano?
Yeah. So what you can do easy, you can just go online, go to medcheck.com.ph, just click find a doctor, and then no downloading of an app. So pag mag-book na kayo ng appointment, i-confirm ng doctor, tapos you'll get a link, tapos i-click nyo lang yung link and then join the call. So as easy as that. So no downloads needed.
This is through phone or kailangan, minsan yung iba kasi, like ako nung nagpa-teleconsult na experience ko, gusto rin minsan makita ng mga doctors yung patient, di ba? So gusto nila video call, pwede rin yung ganon.
Pwede yung ganon. One of the most interesting things actually, since pwede more than 2 people, for example, yung mom nyo abroad, tapos nandun kayo sa bahay, tapos yung doctor. So you can have a teleconsultation with 3 people, the doctor, your mom, and yourself, for example.
Meron ka bang pwedeng ibigay sa amin na estimate kung magkano yung binabayad pag teleconsult? And then paano naman magbabayad? Online din ba?
Yes. So normally, the doctors set up the cost, their own cost of consultation, the platform, and it can range from maybe 200 pesos to 1,200, depending also on the specialty. Of course, the doctors will place their fee there, and then you can pay online. So ngayon, ginagamit na natin yung online platforms to pay the doctors.
Tapos meron din bang mga information about the doctor? Minsan yung iba gusto nila yung matagal na yung doktor, 'di ba? Yung medyo veteran na, yung iba naman gusto nila medyo bata pa yung mga doktor. So nakikita ba 'yan doon sa website?
Yung doctors po, may type of specialty. Nakita yung specialty nila. So, nakita din yung clinic. So, if you want to also call, you can call the doctor's clinic, get more information about the doctor. Also, talk to the secretary as well para hindi lang very monotonous na when you start booking a platform. You can also call the doctor. They will have their contact details there as well.
But yung mismong background, hindi siya nakalagay. Kasi nakita ko yung ibang website, may nakalagay kung saan yung nagpa-practice yung doktor or kung saan graduate or how many years na walang ganong klase ng information.
We don't have that information on our platform, but we do have the types of specialties and subspecialties of the doctor.
On the part naman of the patient, what kind of information do you need pag magla-log in sila? Para lang ma-prepare nila just in case gusto nilang kumuha ng consultation.
Yeah, so as a patient, we'll need very basic information: first name, last name, middle name, date of birth. And of course, if it's a telemedicine consultation or you want to go to the doctor's office. And you can also add your diagnosis or any doctor's notes once the appointment is booked.
Sige, marami pa tayong pag-uusapan mamaya. In particular, paano naman yung mga may COVID mismo, no? Kung paano sila magpapacheck. Kasama pa rin natin si MedCheck Country Head Anna Bigornia sa pagbabalik ng Newsroom Ngayon dito sa CNN Philippines. Kasama pa rin natin sa serbisyo ngayon si MedCheck Country Head Anna Bigornia. Anna, so sa ngayon, marami bang mga pasyente na nagta-teleconsult? Gaano katagal yung queuing time pag gusto nilang magpa-schedule? And then, ano-ano ba yung mga klase ng doctors na available?
Yeah, so we do have a range of doctors. We have doctors who are in oncology, infectious disease, pulmo, and some pediatricians, as well as some general practitioners. So we have a range that you can see on our website when you filter. We also, when you book an appointment, meron ng slots. Yung slots po, the doctor set the slots. Tapos kung wala na dyan, hindi na po available yung slot. So sometimes you see doctors that have probably 10 to 12 slots in a day. And then you can book those slots medyo for an hour, have your consultation with a doctor.
So, ibig sabihin, hindi naman matagal yung paghihintay. Pwede ka kasing makipili ng schedule, no? Like maybe within the week, pwede ka mamili ng araw na gusto mo.
Yes, that's right. That's right.
And another one, dahil syempre virtual nga, yung sinasabi ko sa'yo kanina, minsan yung iba gusto ng video calls. Ano pa ba yung ibang limitasyon ng teleconsultation at paano natitiyak na tama pa rin yung assessment or yung magiging payo ng doktor?
So, general limitations po. One, technology limitations. Siyempre, you have to have your internet connection. Also, yung device nyo po, kung internet connection, may camera po ba kayo? Kung gusto nyo po mag-video call or microphone. And then yung device po, you can have it on a phone or on a laptop. Other limitations do also include, for example, if you're talking about secure digital solutions, so dapat po when you do telemedicine consultations as a patient, you should also know if the platform you're going with is compliant with our data privacy and or HIPAA. So those are the key limitations po.
Sa ngayon kasi, inilabas ng DOH yung kanilang listahan, no, ng mga tulad nyo na accredited na teleconsulting providers. No? Pero ano ba ang kahalagahan, especially for COVID-19 patients? Kailan ka ba dapat to make sure na meron kang consultation mismo sa doktor? Kasi yung iba ang ginagawa, di ba Ana, nag-google lang, nagsisearch lang online. So if you're a COVID patient, ano ba dapat mong gawin?
So our medical community comes up with guidelines for COVID symptoms and flu, but the best is to book, when you feel these symptoms, to book a consultation with an infectious disease expert already so they can give you more accurate information on what to do. As I mentioned before, telemedicine becomes the first screening so that the doctor knows whether or not to have a face-to-face consultation with you. And if you can have remote care, it should be resolved as well.
And then if parang critical na or medyo serious na yung symptoms, paano malalaman yan sa teleconsultation? Kayo na rin ba yung nagsasabi na dapat nagre-recommend na dali na sa ospital? Paano yung proseso nito?
Yes, our doctor should be the doctor should be recommending that.
And then in terms
based on the assessment of the patient.
Okay, and then in terms of follow-up checkup, halimbawa if you're a COVID-19 patient, di ba, if for example you turn out positive, pwede ba yun na parang for the next 7 days or for the rest of your isolation, ay everyday kang magpapacheck or anong paraan ng follow-up?
Yes, you can. So our doctors in our platform, we do have a follow-up which reminds the patient to book an appointment again with their doctor. So if the doctor says, oh, magpa-follow up ka next week, so my reminder po sa patient so you can book again next week and have that follow-up with your doctor.
Also, tanong lang din, no, yung mga ganito bang consultation, pwedeng sagutin ng insurance or ng PhilHealth?
It depends po on the doctor. So, for insurance, the doctor will put, when you book, they'll put what type of insurance that they accept
okay.
as well. Yeah. And PhilHealth, for PhilHealth, some doctors will accept it for outpatients or for inpatients. So, yeah.
Huli na lang, Anna, at can you tell yung viewers natin yung importance talaga na magpakonsulta pa rin, hindi magse-self-medicate or hindi titingin lang, iiwan lang sa online, no? Or aalamin lang nila sa online. At this point, gaano kahalaga na makapagkonsulta pa rin sa doktor?
So it's very important to get an expert opinion for your symptoms because we also don't, their opinion is valuable so that patient care is continuous and they know the importance of keeping patients in great health conditions.
And then we're flashing your contact information. Maraming salamat sa iyong panahon, si MedCheck Country Head Anna Bigornia.